Now, the long-term health consequences of COVID-19 remain largely unclear to many of us. And in most cases, COVID-19 survivors are mainly troubled with fatigue or muscle weakness, sometimes sleep difficulties and anxiety or even depression. This happens at 3 to 6 months after patients have recovered from acute infection. The University of Stellenbosch launched a study in a quest to establish the extent of the problem in South Africa. To talk to us more on this, we are joined by Professor Risia Pretorius from the university's Department of Physiological Sciences. Professor, very good evening to you, and thank you so much for your time. Now, there is this term that has been coined, long-term COVID. What exactly is that?
Yes, good evening. So across the globe, a subset of patients that have recovered from COVID-19 experience a wide range of persistent symptoms, as you mentioned. And these symptoms, unfortunately, do not resolve over many months. So this new syndrome is called long COVID. So some of the main lingering symptoms, as you also mentioned, is fatigue or muscle weakness, being out of breath, and many patients complain of sleep difficulties and anxiety or depression. And other common complaints are forgetfulness and struggling with concentration.
Now, it is reported that about 25 to 35% of cases actually will suffer from long COVID. What are the parameters that determine whether or not one will suffer from long COVID or not?
Yes, that's the question that we would want to answer. So the registry that we have just launched at Stellenbosch University would like to better understand the disease and the extent of long COVID in South Africa in particular. And secondly, we would also wish to determine the prominence of the comorbidities in long COVID, because we need to understand whether it is individuals that have got a specific list of comorbidities that might have them more prone to develop long COVID.
Now, tell us more about this study and how it's going to be implemented.
Yes, so the first part of the study, as I mentioned, is this registry where patients can log on and just simply fill in the registry. It's a simple, quite short registry. And then near to the end of the registry, they can also log their details for us to study their blood samples. Unfortunately, currently, this part of the study is only available in Cape Town and the Winelands or bigger Cape Town area until we have secured additional funding to take it further to the rest of South Africa. So the reason why we would like to specifically look at the blood samples from these individuals is because we believe that the answer lies in the blood, and probably there might be some clues with regards to inflammatory molecules that is in circulation that we would like to find in the blood samples. We have been studying blood samples of individuals with long COVID in a small preliminary study. And we have discovered that patients suffering from long COVID have increased novel inflammatory molecules, particularly that prevent blood from breaking down, blood clots from breaking down effectively when they form. So therefore, we are in search of such molecules, and we need to confirm the results in a bigger study.
So having this information, how does that affect the way that you will treat COVID in those who may be susceptible to contracting or experiencing the prolonged symptoms of COVID?
That is now the million-dollar question. We really need to find out which molecules are in circulation, what are they doing, and how are they affecting the various symptoms that we see, and how are they causing the various symptoms that we see. Because as we know, there are a lot of symptoms, the few that I mentioned, but recent studies, particularly done in America and the Long COVID Alliance in America, that focuses specifically on long COVID patients and trying to find out what is happening in these patients, have found that there is up to 150 symptoms that have been identified and linked to long COVID. So the whole aim of this project is to desperately search for molecules in the blood to give us clues on how to treat it eventually.
The information that we currently have, Professor, points to a period of between 3 to 6 months for the perpetuation of long COVID. Those who have suffered from long COVID and are post the 6-month period, have they shown a reduction of their symptoms? Have there been cases of complete recovery in those particular patients as well?
What is very interesting from research coming out from the Long COVID Alliance in America as well as from South Africa is that in some cases there are people that had acute COVID and recovered from the acute disease for over a year and still suffering from these very debilitating side effects. So there have been people that, as you mentioned, recover or feel better and as they progress. However, what is very, very worrying for clinicians as well as researchers is the fact that it seems that there's a part of the population that simply do not recover, and that is a dilemma for us.
So you're basically saying that COVID-19 can have irreparable long-term implications on one's health going forward?
It might have, however, that is why we are doing this research, because if we could find the origins of the molecules that are causing the long COVID and the persistent lingering effects, then we will have a possibility to find a treatment for that. And we are very positive that we will find a treatment and that we will find the molecules that are causing these persistent and lingering disease progression events in long COVID. Yes, so we need desperately to find a solution, and the solution is research, and we're trying our best to do that.
Perhaps it might still be early days for me, Professor, to be asking this question, but with the advent of the vaccination rollouts that are taking place around the world, what might the impact of vaccination on a potential patient have on the long COVID?
Well, firstly, I think we need to get people vaccinated as soon as possible. The dilemma is that you don't know if you have acute COVID, whether you will eventually end up with having these lingering, persistent long COVID symptoms. So the most important thing is we need to get vaccinated, every single one of us. And that is the only way how we can prevent people from getting COVID in the first place and then resulting in these lingering and persistent symptoms of long COVID in future.
One thing that's not really spoken about, Professor, is the fact that the vaccination process, as well as all the studies that are being conducted, are still very much on an experimental basis, in the sense that, nothing really is guaranteed. It's still very experimental, is it not?
The vaccines have been tested really well, and I don't think we need to worry about the science behind the vaccination. The scientists working on it, Pfizer and all of the rest of the companies that's been working on producing these vaccines have really done a wonderful job. So I think the most important thing is we must give it a chance. We must take the vaccines and we must try to stop acute COVID. That's the only way how we're going to prevent long COVID from happening.
Let's round off our discussion this evening, Professor, to talk about the online long COVID registry. Who is eligible to be a part of it and how can they participate?
Yes, thank you very much. Yes, the Long COVID Registry is a registry open for everyone in South Africa that suffer from long COVID lingering symptoms. They can fill in the registry, and then if they are in the Cape Town, bigger Cape Town area, the Winelands area, there's an opportunity for them to click on the registry so that I know that they would like to also partake in our research laboratory study. Just to say that it has been ethically cleared. We've got ethical clearance from Stellenbosch University's Health Ethics Committee, and all the data will be anonymized. So nobody will be able to know you on whatsoever. It will be anonymized. We will publish the data as well. The link that you can find the registry on, you can either go to the University of Stellenbosch website, where you will find the article. It is also in News 24 in their article. And then you can always go to my website. My personal research website is www.rishapretorius.net, and to spell my name, RESIA.
Professor Risha Pretorius, thank you very much for that insight into long COVID, as well as opening up for all those who wish to participate. If you are in the Cape Town area and you are suffering long COVID symptoms, you certainly are invited to be part of the survey and the study that they are conducting. Professor Risha Pretorius there from Stellenbosch University.